Hello, class. Dr. Fife here. Welcome. Today we're going to talk about altered cellular and tissue biology. Please keep in mind I'm only covering certain portions of the chapter, and students are required and responsible for reviewing the entire chapter. First, we're going to talk about cellular adaptation. Normal cell is restricted by a narrow range of structure and function, but it can adapt to physiological demands or distress to maintain a steady state of homeostasis. So adaptation is reversible structural or functional response to both normal and physiologic conditions and adverse or pathological conditions. Atrophy, in which we have the decrease or shrinkage in cellular size, this most commonly affects skeletal muscle, the heart, secondary sex organs, and the brain. Hypertrophy, we have an increase in the size of the cells and consequently in the size of the affected organ. The cells of the heart and kidney are particularly responsive, and this is where we can end up with hypertrophy in the heart from elevated blood pressure or other factors. Hyperplasia is the increase in the number of cells resulting from increased rate of cellular division. And this is response to injury when injury is severe and prolonged. Dysplasia, which is not really a true adaptive change. This refers to abnormal changes in size, shape, and organization of mature cells. And an example of this is changes in the epithelial tissue in the cervix. Metaplasia is reversible replacement of one mature cell by another, sometimes less differentiated cell type. An example of this is replacement of the normal columnar ciliated epithelial cells of the bronchial airway lining by squamous epithelial cells. And this image is here just showing the different types of cell changes. Cellular injury, reversible injury is when injured cells can recover, or we can have an irreversible injury where those injured cells die. This can be caused by an hypoxic injury in which there's lack of sufficient oxygen, and this is the single most common cause of cellular injury. This can result from a reduced amount of oxygen in the air, loss of hemoglobin or hemoglobin function, a decreased production of red blood cells, and it can be the consequences of respiratory and CV systems. Hypoxia can induce inflammation, and inflamed lesions can become hypoxic. And when there's anoxia, there's a total lack of oxygen. Free radicals and oxidative stress. This is an important mechanism of membrane damage is injury induced by free radicals, especially by excess ROS called oxidative stress. Free radicals, it's an electrically uncharged atom or group of atoms having an unpaired electron, and having one unpaired electron makes the molecule unstable. Free radicals are difficult to control and initiate chain reactions. ROS play a role in the initiation and progression of cardiovascular alterations associated with hypertension, hyperlipidemia, diabetes, ischemic heart disease, chronic heart failure, and sleep apnea. This oxidative stress can worsen those conditions. I might have chemical injury. This begins with biochemical interaction between a toxic substance and the cell's plasma membrane, which is ultimately damaged, which leads to an increased permeability. There's two general mechanisms. We have direct toxicity by combining with a molecular component of the cell membrane and organelles. And we have reactive free radicals and lipid peroxidation. Now, examples of chemical agents that cause cellular injury, arsenic, cyanide, different air pollutants, insecticides or herbicides, carbon monoxide, alcohol, lead, and mercury are all known chemical injuriants. Now, asphyxial injuries. This is failure of the cells to receive or use oxygen. It can be partial or hypoxia, or it can be total, which is anoxia. One way of this is suffocation. Oxygen is failing to reach the blood. We could have choking, asphyxiation, obstruction of the internal airways. Strangulation is caused by compression and closure of the blood vessels and air passages resulting from external pressure on the neck. And we have chemical asphyxiants, which block delivery of oxygen to tissues or block its use. An example of that is cyanide. And we have drowning, which is an alteration of oxygen delivery to the tissues resulting from the breathing in of fluid, usually water. Now we can have temperature extremes that can cause issues such as hyperthermia. And hyperthermia is an elevation of the body temp without an increase in hypothalamic set point. This can produce nerve damage, coagulation of cell proteins, and death. At a temperature of 105.8 Fahrenheit or 41 degrees Celsius, nerve damage produces convulsions in adults. At 109.4 Fahrenheit or 43 Celsius, death will occur. Hyperthermia might be therapeutic, such as local, regional, or whole body induced hyperthermia to destroy microorganisms or tumor blood flow. This can happen with like a fever trying to fight off an infection. Accidental, where you can have heat cramps, heat exhaustion, heat stroke, or it can be caused by malignant hyperthermia or neuroleptic malignant syndrome. Now with a heat stroke, there's potentially lethal result of overstressed thermoregulatory center, and the heat loss is through evaporation, sweating ceases, and the core temperature rises. And it's important to note that the sweating does stop at that point. Here's some different symptoms of heat exhaustion or hyperthermia listed here in this diagram. Now, opposed to that, we have hypothermia, which is a body temp less than 95 degrees Fahrenheit or 35 degrees Celsius. What happens here? We get vasoconstriction, shivering, an alteration in microcirculation, coagulation, and there can be ischemia to tissue and cause tissue damage. This can be accidental, such as falling into a body of cold water or prolonged exposure to the cold weather outside. Therapeutically, this can be used to slow metabolism and preserve ischemic tissue after brain trauma or during brain surgery, after cardiac arrest, and in neonatal hypoxic encephalopathy. My sister, who suffered a massive heart attack, was put on the therapeutic cooling and actually was able to wake up and recover pretty much thanks to that system of that therapeutic hypothermia. And here's just some more information on hypothermia. We have ionizing radiation. This is any form of radiation capable of removing orbital electrons from atoms, resulting in the production of negatively charged free electrons and positively charged ionized atoms. The environment is an important source of exposure to ionizing radiation. This can come in the form of uranium, thorium, or potassium, or such medical procedures as X-rays and CT scans. There's two types of cellular damage. There's deterministic effects, which is thought to occur above a threshold dose and have dose-related increasing risks. This can cause dermatitis, erythema, or cataracts. Or stochastic, which includes cell generation and hereditary effects and cancer. And this is an example of this is radiation dose-related cancer. Manifestations of cellular injury. We have cellular manifestations called accumulations. An important manifestation of cell injury is the resultant metabolic disturbances of intracellular accumulation of abnormal amounts of various substances. Cellular accumulations or infiltrations occur as a result of not only sublethal injury sustained by cells, but also normal but inefficient cell function. Two categories of substances that cause accumulations. We have normal cellular substances, such as water, proteins, lipids, and carbohydrate excesses. And we have abnormal substances, which are either endogenous or exogenous. Water, we have cellular swelling, the most common degenerative change, and this is caused by a shift of extracellular water into the cells. Cellular swelling is reversible and is considered to be sublethal. Lipids and carbohydrates. Certain metabolic disorders result in the abnormal intracellular accumulation of carbohydrates and lipids. Accumulations are caused by inherited disorders with insufficient enzymes or ineffective forms of enzymes. And the most common site of intracellular lipid accumulation or fatty change is in the liver cells. And finally, cellular death, we have necrosis and apoptosis. Necrosis is a rapid loss of plasma membrane structure, organelle swelling, mitochondrial dysfunction, and lack of typical features of apoptosis. Necrosis is the sum of cellular changes after local cell death and the process of cellular self-digestion known as autodigestion or autolysis. And cells die long before any necrotic changes are noted. There's different types of necrosis. There can be coagulative, liquefative, caseous, fat, or gangrenous. Now, apoptosis is the active process of cellular self-destruction called programmed cell death. And death by apoptosis causes loss of cells in many pathological states. Severe cell injury, accumulation of misfolded proteins, infections, in particular viral infections, and obstruction in tissue ducts. The diagram here is just showing the difference between apoptosis and necrosis. That's all I'm going to cover for this chapter. Please make sure you review the entire chapter. Thank you all and have a great day.